What I would like to do is ask the following people to come up and do a 6 feet distancing beside me because you're part of our leadership team and you're here today. So Colonel Byrd from Goodfield Air Force Base, Caitlin Brosh from ASU, Whitney Wood from SAISD, Sam Spooner from ASU, Walt Koning from the Chamber is here with us today, and absolutely Nora Perry from Shannon, representing both Shannon and our new Shannon South campus. And then I think we have, and Judge Floyd is sick, so we have Nate, who is going to represent Judge Floyd and the county today. The purpose of today's meeting is the following. With the number of positivity cases continuing to rise, we've had many citizens who are quite concerned about what's going on in the city of San Angelo and asking a lot of questions about the numbers. Talk to us a little bit more about the numbers so we better understand the profile of the community as it relates to the pandemic. What is important for you to see today is the group of people that are up here surrounding me today, because this is the group of people that every Monday morning at 9 a.m. we have a conference call to make sure that we, the city, know everything that's going on in our community and that they can share with us their numbers, their game plan, their strategy to continue to contain the number of positive cases. And so it is this leadership team that is helping San Angelo battle the pandemic virus. Many of you have seen and heard the numbers in the surrounding communities. Abilene's Hendrick Hospital announced yesterday they only have 1 ICU bed left. El Paso, as you know, is going on a partial shutdown, asking people to stay at home. Lubbock and Amarillo are in a really difficult situation because their positivity cases have skyrocketed and they are at full capacity in their hospitals. So our surrounding communities are feeling a surge. And we don't know whether it's the first, the second, or the third, but it really doesn't matter whether it's 1, 2, or 3. It's what it is, and it's still here in this community. And we want to continue to emphasize that fact. The pandemic, COVID-19 virus has not gone away. And I hear every day about people saying, I'm so tired of the COVID-19. I am so tired. I'm fatigued with all of the rules, regulations, and the attempt to control our lives. But what I must say to our citizens today, if you want to continue to have the great city that we are, if you want to continue to keep our businesses open and the occupancies where they're at, if you want to make sure that the hospital has the ability to take care of you or your family should you need them to, then we have to continue with following the CDC guidelines. I get many emails and phone calls from people who say, why have you stopped enforcing the mask order? Is it no longer enforced? Does it matter anymore? Because fewer and fewer people are wearing the masks. Fewer and fewer people are obeying the CDC guidelines, whether it's social distancing or whether it is meeting in groups of 10 people or less. Families are gathering, weddings are happening, events are happening, and the good news is Dr. VRETIS has been able to continue to approve some events because he's put great guidelines in place for holding those events. But what has to happen is once people arrive at those events, those guidelines have to be enforced. If you take a look at what's happening in the city today, the largest growth in terms of number of positive cases is happening in the 20 to 29, 30 to 39, and 40 to 49. And you say, well, that's the largest part of the population. Well, it is, but on a weekly basis, some of that changes. So if you take a look at the 40 to 49 category, last week there was an 87% increase in the number of positive cases. 87%. If you take a look at the 20 to 29 age category, last week there was an 80% increase in the number of positive cases. And if you take a look at the 30 to 39, the last 2 weeks have been in the 59 to 63 range. as it relates to where are the largest number of cases overall, well, certainly it has been a trend that the age group of 20 to 29 has been the largest group. But that percentage is continuing to decrease, and the percentages of positive cases in the other age categories, particularly in the 40 to 49%, continue to grow. So we are pleased with our school system in terms of what they've been able to do strategy-wise to contain the number of positive cases. Most people expected when the schools opened back up that in fact it would be the 0 to 19 age category where we would see the highest number of cases and a tremendous growth in that area, and that's not true. I want to say to our business community, we need you to help us enforce the rules and the regulations. We know you're tired of asking people to put on the mask when they enter your business. We get it. But I also know you want to keep your doors open. You don't want to have your occupancies reduced. You want to continue to operate and serve the community and continue to be able to provide for your family. And so it is our business community that can have a positive impact on us. But again, it is the community, the citizens that have the greatest ability to help us continue to fight the COVID-19 pandemic. It is if our citizens take personal responsibility and make a decision that they want to be a part of making San Angelo the better community in West Texas, we need to do that. It is in our hands. It is about committing to personal responsibility. It is about having respect for your fellow citizens. It is about having the courage to say, no, we're not going out tonight, or no, we're not going to that family reunion, or no, we're not going to do whatever the event is. We do want our lives to go back to normal. We all want that. We all want an opportunity to not have to follow the CDC guidelines. But the reality is the fine, unless we continue to follow the CDC guidelines now, we're going to have this pandemic and the growth in our positive cases continue. And what we need to be doing is reducing the number of positive cases. And yes, you can say, in fact, that the largest number of deaths are in the 70 and older category. But remember, their death is a result of somebody infecting them and them testing positive. It doesn't mean that they were the ones who were the reason they have COVID-19. They got it somewhere. And yes, we know that the age group is where the death rate is coming from, but we also know grandparents deserve a good life too. We know that our aunts and uncles deserve an opportunity to meet with the family and not worry about it. It is in our hands. It is about personal responsibility. It is about making sure you believe enough in this community to do the right thing. And so we are asking you today to continue to follow the CDC guidelines. We don't want to get to the point where our hospital capacity is at a rate where we are in trouble. And right now, I believe our COVID number of hospitalizations is around the 36, 37. It's been consistent for about 2 weeks. And I believe that's somewhere around the 6% rate. I'm looking for a head to confirm that. I don't see that head nodding. Yes, okay, so yes, it's about 6%. So we're in a good spot right now, everyone. Compared to our neighboring cities, we're great. But let's stay in that positive, great space. And we can do that if we continue to follow the CDC guidelines. I've gotten to the point the mask just feels normal to me. In fact, I worry when I start reaching up and I don't find the mask there because it feels like it's like my earrings and it's like a part of my life now. And that is a part of our life right now. So do the right thing, citizens. Help us. We need your help. And that's what today's press conference is about, is asking for the citizens' help to continue to work towards reducing the number of positive cases on a weekly basis. We're at 13.7%. Last week we were at 10%. And the governor has said any rate over and above 15%, any positivity rate over and above 15% is a cause for concern. Well, we're on that line. We're really close. The judge has been given the authority that should our hospital capacities go up beyond 15%, he has the right to start closing businesses, occupancies, etc. And we don't want to put the judge in the position of having to make that tough decision. So with that, I am going to open up the floor for questions and comments, and I have this leadership team with me. Dr. VRETIS is over here. He might want to offer a few words, and certainly have an opportunity to ask him some questions. Dr. VRETIS?
Thank you, Mayor. I've got to agree with what the mayor said. We look like we're in a pretty good position now, but what happens to us this next week, this next month, is really determined by what the citizens do. It's not so much what the government does, it's what you do as citizens. And I can't emphasize enough how important it is that you do the stuff we've said all along. You wear your mask, you wash your hands, you social distance. There was a recent study out of Kansas, kind of a happenstance study. The governor of Kansas mandated statewide you must wear a mask. But each county government was able to either say, yes, we're going to go along with that mandate or not go along with that mandate. And only 20 counties actually went along with that mandate. So they look at the COVID positivity rate in the counties that have masks on and the counties that did not wear a mask. And if the counties that do not wear a mask have twice the positivity rate of the counties that do wear a mask. And this is in Kansas. You know, I never thought I'd say, let's look to Kansas. Yeah. And they actually, I think it's the London School of Medicine that actually looked at cell phone records of the people in Kansas so they can tell how people move around within the state, within the city. And people are moving around the same amount in the counties with mask and without mask. So the only real big difference between the high rate and the low rate of COVID is whether people were wearing a mask. So wear your mask. You know, I'm tired of wearing a mask. I have to wear 2 masks at work. If I go in to see a COVID patient, I've got to have a full face mask on, gowns and everything. I'm so over COVID. But you know, COVID's not over with us yet. So you've got to treat it like your life depends on it, like your neighbor's life depends, like your parents' life depends on it, because it really does. It's up to each and every one of us to wear our masks, to do the socially responsible thing. Sometimes I hear people say, well, you know, the people that are dying are the old people. And yeah, as a rule, most of them are older than the general population. But these are the same people that a year ago were talking about how pro-life they are and how they were against euthanasia or anything like that. And now all of a sudden it's like these old people's lives aren't important anymore. It seems like their moral compass has taken a hard left turn. It's up to us to watch out over everybody in our community and do our part. Thank you. Thank you, ma'am.
Yes, Joe.
I have a handout with my questions. These are the questions that I'm Joe Hodges, Angelo. This is the city publishing. I'll touch up there right here.
Thank you.
They published the chart. You want from the copy here? I'll give you the same time. They published a chart of the daily COVID positive test rates, all the way up, from the beginning of this pandemic back in March, all the way up to today. The thing our readers want to know is, why is it that the mask mandate, which happened right before the first big bump there, has not affected, doesn't appear from this data to have affected the COVID infection rate?
Well, I can answer that in combination with Dr. VRETIS. Because the reality is that if you follow the mask order, you will see that there was very strong compliance with wearing a mask in all of our big box stores. Very strong compliance, and in most retail stores. The problem is what happened when people went home. It's what happened in the backyard, at the barbecue, at the lake, it's the celebrations, it's the weddings, it's the birthday parties, it's all of those events where you have more than the 10 people coming together. If we could just track the number of positive cases in our retail stores, you would probably find a very low rate of transmission. But it's what happens when the mask comes off, and the mask comes off when we go home. That's my perspective.
I think the mayor's probably right on that, that I think a lot of the spread that we're having is not, like she says, in the stores. It's the gatherings, the family gatherings coming over. We're going to have a picnic. We're going to have a barbecue. And instead of having just one family, you end up with 5 families there, and they're all sitting around barbecue tables. And there's no such thing as social distancing when it comes to a barbecue at most houses. The University of Texas COVID-19 Consortium actually came up with predictions by trauma service area of what do they predict COVID is going to be like, specifically on November 8th of this year. And for trauma service area K, our service area, there's a 29% prediction, positivity rate, that our hospitals are going to be completely full on November the 8th. There's a 45% chance that our ICUs are going to be completely full on November the 8th. I can't do the math that they did to do it, but these are people that do modeling for a living, and this is their prediction. Like the mayor said, we're so much better than everybody around us, but we're just hanging on by a little thread. It won't take very much to get a big bump, and once you start getting exponential growth, it's hard to undo exponential growth. You have to wait 2 weeks from when you make any change before you even start to expect to see a change.
One second, let me just make this comment. The other thing I've heard people say is that when the election is over next Tuesday, the pandemic will go away. Well, tell that to Great Britain. Tell that to Germany. Question?
San Angelo Standard Times. Just for the record, if San Angelo's positivity rate hits a 15% threshold, even if Texas isn't at that 15% threshold, would San Angelo start to see shutdowns similar to what we saw in March and April? And what would those shutdowns look like?
The governor has given authority to the county, and Nate's here with the county for Judge Floyd. I don't know if you want to add to that, and I'm glad that he gave the county the authority, because what happens in a county like San Angelo, where the largest percent of the population is within our city limits, people were leaving the city limits and doing events outside the city limits. So if we don't have total control over the county, meaning the city limits and what's not in city limits, then we have a hard time with a game plan. So the governor has allowed individual counties to make their own decisions should that number go up. So he has pretty much said we're not going to do that total, the state is all one is all. We're looking at it county by county, and that's something that we have asked for and have been asking for since the end of April, that we be allowed as a San Angelo City, Tom Green County, to make our own decisions concerning rules and regulations, and we finally have it. So again, we want to make sure we do the right thing, social responsibility, personal choice, because we want local control.
In the unfortunate event that hospitalization rates were to rise past the 15% level, it would take some of the options out of our local leaders' hands. I think Judge Floyd's office would come to the conclusion that we need to stay in line with GA 32, Governor Abbott's most recent order, and following safety protocols at that point.
And what are they? What are the safety protocols?
Well, our current safety protocols put in place, set forth by the CDC. So if we continue to follow those protocols, then I think that we should see a decrease or at least stabilize with our hospitalization rate. Should that rate increase over 15%, that's going to be a difficult decision that I think that eventually that will come out of the judge's office. It'll be out of his hands at that point.
So would the Judge Floyd then close bars? Would he close restaurants? What is the step when the hospitalization rate reaches 15%?
Should that occur, then it's going to be a case-by-case scenario. That'll be a decision, a difficult decision that has to be made. Honestly, at this time, we stand with our community partners in our request and asking the public to help us maintain the spread, follow proper protocol at this time, our health protocols that are in place by the CDC. If we can obtain that and achieve that, then we won't even have to go down that path.
But if you look at this chart, the virus has been a virus. So what happens if it gets up to 15%?
I don't have an answer for that at this time.
Well, there are decisions that, there's multiple layers of decision-making. One is what if we choose to start closing businesses, if we choose to reduce occupancies, if we choose not to approve special events. So it is multi-tiered. It's not just one thing. It would be a laundry list of things that we would reevaluate. We've been lucky because over the past few months, almost every event that came to Dr. VRETIS for approval, he's been able to approve because of the numbers. And so he would start taking a harder look at event requests based off of the numbers, and that would mean whether they can hold the event, whether the occupancy, the number of people who could attend that event would be. So it is multi-layered. But what we want to make sure everybody understands is we don't want everyone to be in fear of living their lives. We don't want the people in San Angelo to be fearful of the surrounding neighborhoods and their neighbors, because they can take charge. They can encourage their neighbors. They can encourage their friends. They can encourage everyone to help them, instead of us attacking the people who are wearing the mask and making an issue out of the mask wearers. Let's compliment people for wearing the mask. Yes, Matt.
Have health officials been able to identify any hot zones in San Angelo where that could explain the uptake in COVID numbers, or is it just general behavior?
I've looked at the numbers every week by age category, and so, and I've asked the questions of Sandra on a weekly basis. Is there a hot spot? Is there a specific something that we feel like is creating this spread? And the reality is if you take a look at the spread of the age categories in terms of the growth in viruses and the virus positivity rate, as I said, the three key areas are the, and it's a broad range. So if you go from 20 to 49, that's a pretty broad age range. And there's growth in all of them. I'll repeat it. This past Friday, we had an 80% increase in positive cases in the 20 to 29 age category. We had a 59% increase in the 30 to 39 age category, and we had an 87% growth in the 40 to 49. And if you go back a week, you go the 20 to 29 was flat from the previous week. So that would say, well, maybe that's some of the ASU kids, but there wasn't growth 2 weeks ago. If you look at the 30 to 39 age category, it was 63% growth. So depending on week by week, but there's no one hot spot. It's not about the kids going back to school. It's not about ASU going back to school. It's not about the bar singularly being open. And it's not about occupancies increasing. It's about all of those things. And if you take a look at today's numbers, the same thing. The age categories is anywhere from 5 years to 79 years. It's very broad. Would you like to add anything?
Just a little bit to add to that. While there's no one event that we've been able to isolate and say this is where everything came from, a large number of the people that have been hospitalized recently in San Angelo actually have been transferred into San Angelo. So we've gotten several from nursing homes in the surrounding counties. And a large part of our number, a significant number that we've admitted have come from these nursing homes in the surrounding counties. But you got to remember that this is our normal service area. These are people that we normally take care of, these counties. And I think the governor's order isn't just 15% in our county, it's 15% in the whole trauma service area. And that's where our actual numbers come from. So the cases that are hospitalized at other, smaller hospitals, they still count towards our overall number for our trauma service area. But I think locally our hospitalized numbers a large number of them came transferred in from other counties, from other nursing homes.
Joe?
If the infection rates are going up, but the hospitalization rates are staying relatively static, right around that 6%, does that indicate that maybe you're working toward herd immunity kind of thing? It's not that big a deal. Then I'll second this with, on Saturday, Brad Holland and Hendrick handed out a clarion call saying we don't do something up here in Taylor County, we're going to be overrun. Hospital's going to be overrun.
It's been lower than us, yeah.
And it's been relatively flat. So when we hear these dire warnings and we look at the data, it doesn't match up. I mean, there's a disconnect there.
Well, yeah, I'll speak to it. 2 weeks ago, we had 13 people in the hospital. Or 3 weeks ago. Last week, it was about 30 people. This week, it's 38. So in a 3-week period, it goes from 13 to 30 to 38. So, you can take a look at the numbers from way back to March. You can take a look at them from September 1, August 1, et cetera. But I will tell you that we've had the highest number of tests this past week since July the 10th. The highest number of tests this past week since July the 10th. We've had the highest positivity rate since September the 4th. We've had the highest number of positive cases since August the 7th. So you can make numbers very often read what you want them to be, but what they are is a good baseline to look at and evaluate and try to determine what we need to do to continue to keep San Angelo as safe as we can without creating fear, because we're through with the fear thing. I don't want to know about putting fear out there. What we want to put out there is information. We want to put out there statistics that talk about what's going on in this city. I don't want people fearful of living. I want them aware of what's happening in this city. I want them aware of what's going on in our hospitals. I want them aware of what's going on in our school system. And I will tell you that I have been unbelievably proud of our school systems in terms of the game plan they put in place, their execution of that game plan, and a relatively modest increase in cases because of those game plans. Goodfield Air Force Base, the same thing. They've done a great job of executing their game plan. Shannon Hospital has been very upfront, very vocal, very specific about what's going on in the hospitals. The great news about our hospital system here in San Angelo is they're prepared. Back when the closings were happening, we didn't have the PPE, we didn't have the ventilators that we need, we didn't have the game plan in place. We have game plans in place today because this city is organized and we're communicating with each other and we're using all of the leadership that is up here today to help us manage this city. And it's because of everyone up here that the numbers are the numbers. They've done a great job of being leaders in their respective fields. But we also don't want to hide and not be talking to the public about what's happening. The public has said to me, we want to know, Brenda, where's the age category? What are the hospitalizations? What's the number? What happens if? And so today is about saying what if, and here are the numbers. Yes.
So, Matt Travis, Angelo. So, earlier you made a scenario about the November 8th, if the hospitals may fill up or may be full and ICU may be full. Do we have, what is kind of the game plan if that does happen? And what will those numbers actually be? Do we have a total capacity number?
I can tell you what their numbers were from their, if you give me a second here, because my mind's not good enough to remember all that. Okay, so it's probability that will exceed hospital capacity in 3 weeks, which is November the 8th for San Angelo. It's 29%. The projected COVID-19 hospital census on that date was 118 with a rate that varies from 21 up to 752. As far as intensive care capacity being exceeded, a 45% chance of that. The projected ICU census on that date is 18 with a low number of 3 and a high number of 114. And be aware we don't have 114 ICU beds. What will we do? We'll do the best we can. I mean, quite honestly, we may end up having to transfer patients to San Antonio, to Austin, because even though we see big rises in these smaller rural communities, it looks like a lot of the big cities aren't having that big a bump right now. And it's not projected that some of the larger cities will be having the same amount of cases that the smaller communities are. So we may end up having to transfer our patients to other cities. El Paso is already transferring their patients out. So we may be doing the same if it gets that bad. Hopefully it won't. I mean, this is their projection. Yeah.
Do the right thing.
Yeah. It's
The San Angelo Local Health Authority, what do you think the likelihood of that actually happening is?
I think it's fairly likely that will happen. I think their numbers are good. Somewhere in that 30 to 45% chance that we'll be overrun. I had one of my colleagues night before last saw 9 COVID patients on her ER shift. So in 10 hours, she saw 9 COVID patients. We didn't admit all 9 to the hospital, but a lot of people that we see that have COVID that don't meet criteria for being admitted, that we say, okay, you don't meet criteria, we're going to send you home. But we're thinking we might see them back in a day or two. Right now, they don't meet the criteria for admission. But if you look at the trajectory of that patient, there's probably a good chance we'll see them back in a couple of days. So, we're doing the best we can. The COVID service has gotten real busy at the downtown campus. We're looking at how we can move people around between both campuses now. Since it's one system, I think we have a little bit more leeway that we've had in the past. So hopefully we'll be able to handle it.
So a number of the patients that are going into the ICU and haven't been in the hospital are people with underlying conditions or elderly people. So are these, this happen, would this be
well-
like a spike in a nursing home or anything
Well,
like that?
Yeah, some are coming from nursing homes, and we've seen several that we've admitted straight from nursing home that go up to ICU because they're in really bad shape. The downtown campus and I guess the south campus have COVID wards that can handle people on those wards that up until the existence of those wards, they would have been ICU patients, so that they require an ICU level of care. We just have a different place that we do it. We don't call it intensive care, we call it the COVID ward, but they're still getting the BiPAP and the intensive care treatment that they would have gotten in ICU.
With the rising cases, have we seen a rise in cases in nursing homes?
I'm sorry?
With the rising cases that we've had recently, has there been any rise in nursing home cases?
I think there's been a rise, but I think that has to do with just the mandated testing that everybody's getting, so we're actually finding out about more of them.
Get more positive, is that what you're saying?
Yeah, that, and as people go around, I think this last set of cases they got, there were therapists going from one nursing home to another nursing home to another nursing home, and if that therapist is positive, it's gotcha.
I got a question on the testing.
Yes, sir.
When we first started this thing, basically we had maybe 3-4 sources of test data coming in, like Goodfellow, Shannon, from community.
Yes.
Now everyone seems to be testing. You got any lab test now test, Contra Valley ER test. I mean, CMA test, Shannon Clinics test. We have a lot of places that are providing test data.
Yes, sir.
Is that being, how confident are you that all those tests are being compiled? And also, wouldn't that account for the rise in cases? We're testing more, we have testing more available, it's more accessible to people, and then the cases are going to go up.
Well, they are going to,
Yes.
yeah, the more you test, the reality is you're probably going to have more cases. But if you take a look at the positivity rate and you go back and you take a look at the graphs from from July, we're testing more and we're having more positive cases. They do correlate. But the reality is the following is that they're the numbers. So, you got to take a look at the numbers and how many people have tested positive. So the other positive thing is the turnaround on tests. Today, most results are back in 1 to 2 days. It used to be that it would take 3 to 4 or 5 days to get the test results. So the good news is we hope that there's less community spread because we're getting quick results. The good news is more people are getting tested. That's what we want. That's the positive.
So they used to gate people, they had a gating questions before you actually got a COVID test. Are we doing that anymore? Do you have to have symptoms
Most people just go and get tested now. I mean, they still get asked the questions, but there's enough supplies around that most people can go to any of these testing facilities and get tested. So we are doing more testing, and that's one reason that our numbers are up. And I don't really pay that much attention to our total outpatient because they're being handled as an outpatient. And most people who get COVID get handled as an outpatient, do fine as an outpatient. But what worries me is when we start seeing the hospitals fill up. And even though we have room within the hospital, there are times that it takes hours and hours to be able to move somebody up to the floor. And so that time, the ER's down a bed, we can't move them. We do see backlogs. And what's real worrisome is when ICU fills up, even though you don't have COVID, when you come in with your heart attack, we don't have a place to put you. The same thing for the young trauma cases. COVID affects our ability to offer medical care to everybody, regardless of what your medical problem is or your trauma problem is. If we're spending all of our efforts taking care of COVID patients, then we may not have the facilities, the resources to take care of the trauma patients, the OB patients, the pediatric patients. This is really stressing our system. I can guarantee it's stressing the medical staff, the doctors, the nurses. I mean, you don't see smiles on people's faces anymore.
And Dr. Reyes, speak to, like, back in the early days of the COVID here in town, I guess we were treating COVID a certain way with VRETIS, I think is the medicine. Has it changed any? Have we added therapeutics? How, when you're talking to your colleagues in the medical profession, how is it different today treating COVID as it was, let's say, on April 1st?
We don't think anything works real well. I mean, dexamethasone has been shown to help really sick people that are being admitted. Steroids as an outpatient haven't been shown to help. Things that everybody could do if you want to lower your chance of getting severe COVID, take vitamin C, take vitamin D, take zinc, because we've seen the people that get admitted to the hospital, their vitamin D levels are low. And by that time, it's kind of too late to get them caught up on it. So, I take vitamin D every day. Never taken vitamins in my life. I take vitamin D, I take vitamin C, I take a little gummy vitamin every day. I think that makes a difference. Remdesivir hasn't been shown to make any survival difference. Convalescent serum, it's not turning out real great either. So, we don't have a lot to offer. And that's the scary thing is we see these people come in with this horrible lung disease and there's not much we could do. And a lot of them are coming in with horrible GI disease. They got profuse diarrhea now and they're coming with GI symptoms. Headaches, the virus looks like it's attacking more and more different parts of the body.
Other questions, comments? Okay, thank you all for being here. And we'll try to do this on a more regular basis. So as statistics change, that all of you are well informed about the numbers, strategy, etc. So we appreciate what you can do to get the message out there that we need every citizen's help. We need people to take social responsibility, follow the CDC guidelines, and let's keep San Angelo healthy and safe.